So today we had Dr. Lauren Kelley-Chew on, and we talked all about metabolic function, which is so important when it comes to regulating our hormones, our stress response. So many different things are impacted by our metabolic health. And she is the head of clinical product at Levels Health. So Levels is a continuous glucose monitor. And so she works with that company, and it's really using the glucose monitor to really help show us, okay, how do we regulate our blood sugar? What foods are best for us? So we talked a lot about some diet culture, strategies for blood sugar control, women's health and the link with PCOS and hormone balance and menopause, a lot of the short and long-term consequences of poor glucose control. So be sure to listen in, and thank you, Dr. Lauren, for coming on. Hello, Dr. Lauren. Thank you so much for coming on today. We're going to be talking all about metabolic health today. So first, before we dive into all of that, I want to hear more about your story. What got you started into this? Started with Levels, which I love the company, by the way. Let's just get started there.
So excited to be here.
Yeah.
The beginning of my story with Levels really was in my 20s when I was in medical school, and I received a prediabetes diagnosis.
Okay.
This was really shocking for me because I knew that diabetes ran in my family, which is why I had some extra screening. But I was a very avid runner. I had always been super lean. I was eating this diet that was healthy to the best of my knowledge.
Right.
And like I said, I was even in medical school. So in my head, I thought, I kind of am starting to understand health in some ways. And then I got this diagnosis, and it was so surprising. And that started this entire journey of trying to understand blood sugar, trying to understand how different foods affect my body, and really just trying to find different windows into seeing what was happening really in my body. And at some point along that journey, actually years later, I had tried all kinds of things like memorizing the glycemic index of different foods, right? And all of these things. But I got in my head that I really wanted to wear a continuous glucose monitor because I knew that would actually show me. But at that time, there really weren't options. And so I kind of just let it go. And then several years after that, I got reinvigorated to see if there was another option, and I found Levels. And I signed up, but I was put on the wait list. So
Yes.
I thought, okay, well, this maybe one day this will happen. At the same time, I was working at Verily, which is Google's health sciences spin out. And one of my colleagues there had actually left and was working at A16Z. And he and I had actually gone to medical school together as well. And he sent me a text saying, hey, there's a role for you at this startup called Levels
Cool.
that I think would be perfect for you. Would you be open to having a chat with Sam, the founder? And in my head, I actually thought I had forgotten actually that was the company I was on the wait list for. Yeah. And I thought, I don't really think I'm going to join a startup at this moment in my life. But I met Sam for coffee, and basically 3 weeks later, I was at Levels, and I had the CGM on my arm as well. He had gotten me in off the wait list, so I took that as a good sign.
Yes.
Yeah, and the rest is history, and it's been just an amazing adventure for the last year.
Oh, that's so awesome. I love it when things like that unfold where it's so meant to be, right? And now you're where you're at. So this is great. So let's get into metabolic dysfunction, and let's talk about why it's the single largest health crisis in the world today.
I think a starting point is what is good metabolic health? And then we can talk about dysfunction.
Mm-hmm.
So metabolism really is just the complex biochemical processes that convert the food we eat into the energy for our cells. We have about 37 trillion human cells in our bodies, and each one needs energy. So when this process is happening smoothly, we call that good metabolic health. Unfortunately, mostly due to lifestyle choices, for example, eating really high carb, high processed foods, that really beautiful and elegant process is being disrupted, and it's not able to happen efficiently or smoothly. That's what we call metabolic dysfunction. So most people, I think, are familiar with prediabetes and diabetes as examples of high blood sugar, and certainly those are examples of metabolic dysfunction relatively far along. But about 9 out of 10 Americans actually has at least one marker of metabolic dysfunction already. So that means this is impacting almost everybody. Right. It's really shocking from that perspective. And you can be having this type of metabolic dysfunction for well over a decade before things are so out of whack that it gets picked up by your primary care doctor and you're given a prediabetes diagnosis. So there's a lot kind of that I think needs to change from a diagnostic perspective there and a lab testing perspective. But that's really to say that this is a crisis that's happening for the vast majority of Americans, and the vast majority don't know it's even happening to them.
It's so true. I mean, even in practice, this is what I see. Don't you feel like that? Like I'm seeing at least 75% of patients having some form of metabolic dysfunction, or at least they're trending that way. And this is what's leading to all these other imbalances with our hormones. When blood sugar is off, or if our insulin, if we're dealing with insulin resistance, so many things can just catapult from that. This is really at the forefront. So CGMs are so awesome for that, which, me and Beck, we recently did, the level CGM for a little bit, and that was awesome, which we'll talk more about in a second. But let's get into the link between glucose and insulin and what exactly is insulin resistance.
Mm-hmm. So insulin is the body's hormonal signal that tells the body to take sugar out of the blood and pull it into the cells, the muscles, the liver, eventually fat. This is actually a beautiful protective mechanism that the body does to keep sugar out of a dangerous range. And so when your blood sugar is spiking occasionally, then your body produces a surge of insulin and it brings that blood sugar right back down into the healthy range. And that's a normal part of living.
Yeah.
But what happens so often in today's world is that your blood sugar is always spiking. You're basically always high. And so you're producing a lot of insulin all the time. The analogy that I like to use is a parenting analogy, which is that, I think this really speaks to a lot of people.
Yes.
Right? Is like when you're a parent and you rarely yell at a child, that child, when you do yell, they're very responsive.
Right.
Likewise for the body, when you're very rarely having to produce insulin to bring your blood sugar down, then when you do produce a little insulin, it brings that blood sugar right down immediately. But if you're a parent who's always yelling, then your child comes to understand that that is how you communicate. And so they're not really likely to respond to that yelling in any specific way. Likewise for the body, if your blood sugar is always high and you're always producing insulin, then the cells of the body start to not become as responsive to that signal. And that's the beginning of insulin resistance. So taking it just one step further, if you're a parent and you always yell and now you really want your child's attention, you have to scream. You have to do something that's really out of the norm to get their attention. Likewise for the body, if you're in a state of insulin resistance, you're always having high blood sugar, you're always producing more insulin to counteract that, then to really bring the blood sugar levels down, you have to produce so much insulin. And even then, eventually, the cells just don't really respond anymore. And the pancreas can't keep up. The pancreas, of course, being what produces the insulin. And eventually you're just in a situation with no matter what the body's doing in terms of insulin, the blood sugar cannot be brought down into the normal range, at least not in a sustained way.
Yeah.
And that's when you finally move into territory of prediabetes.
Which is and you just feel, it takes a while to get there, but you just feel awful too getting there, don't you? Those those highs and those lows, we
Right.
really have to learn how to regulate that. So what are some, short-term consequences of these, highs and lows, and long-term consequences?
There's so many.
I
In
know.
my mind, right? In my mind,
We could
metabolic
talk forever.
dysfunction,
Yeah.
right? I mean, it really impacts almost every experience of the body. But in the short term, some of the most noticeable things are brain fog, mood swings, as you pointed out, hormonal imbalances that might manifest as things like acne, weight gain, even things like wrinkles, which is not to say that the goal is to be focused on vanity, but when you're high, when your blood sugar is high all the time, it actually interrupts the healthy function of collagen. And so that if you see that happening on the outside, there's similar processes happening on the inside. So I think you can see that as just one of the most kind of external manifestations of this. In the long term, metabolic dysfunction is linked to 9 out of 10 of the leading causes of death in the US. So everything from Alzheimer's disease to cardiovascular disease. I mean, it really is the underlying mechanism for so many of the chronic conditions that really have such a huge toll for Americans and really for people all over the world. Diabetes is the leading cause of death in Mexico, for example.
Wow. And then even Alzheimer's, right? The type 3,
Right.
that. So it's just so scary when you think about it, especially when, like with you talking about earlier, people walking around not knowing that they're even going down this path, right? What about women's health, like things like PCOS? And can we talk a little bit more about hormone imbalance with blood sugar?
Absolutely. I think PCOS, polycystic ovarian syndrome, is probably the most kind of well-known and prevalent example of this. And really, that is a situation where high levels of insulin are signaling to the ovaries. It's actually pretty interesting that even when most of the cells of the body have become resistant to the signal of insulin, therefore insulin has to be produced at higher levels, but
Yeah.
the ovaries actually continue to be very sensitive to the signal. So the ovaries are still hearing that signal loud and clear. And this is basically a child who has remained sensitive to their parents yelling and screaming as if that was the first time they had heard it, right? It's like, so what happens then is that the ovaries are put into overdrive. And what people don't understand sometimes, I think, is that the ovaries actually produce hormones, and that insulin signal tells them produce more of those, and specifically can produce androgens and kind of
Yes.
hormones that people think of as being more on the male side of the spectrum, like testosterone. Now, the reality is that testosterone is the most prevalent hormone in the female body, and our bodies are exquisitely sensitive to it.
Mhm.
But what happens when you have these high levels of insulin signaling the ovaries in this way, and this is just one example of what's happening in PCOS, you get a very pronounced hormone imbalance. And then you start to see the things that are linked to that. You start to see acne, weight gain, issues with ovulation. So it's really kind of amazing. And I think, unfortunately, so much of conventional medicine's solution to this is putting a band-aid on it rather than
Right.
fixing the underlying cause. So in some ways, it's like we're allowing this metabolic dysfunction to continue by
Yeah.
masking it. And I think that does a real disservice to anyone who's experiencing this issue.
Right. What about, how important is it for menopausal women, right, to really get a hold of their blood sugar? Let's talk a little bit about that.
This is a fascinating area of evolving research. And I think one thing that's important to note on all this conversation about women's health is that there has been surprisingly little research done on metabolic health and women's health. I
I
mean,
know.
it's right. This is true in healthcare research in general, but especially also you can see it in metabolic health. And so there's really, it's evolving. But there's people like Sarah Gottfried, for example, one of our levels advisors, who's really taking an active role in pushing the research forward on this front and also having a voice in the dialogue. That's a long prelude to say that there's increasing evidence that blood sugar spikes and drops, which is, say, poor blood sugar control, is linked to many of the symptoms of menopause, like hot flashes.
Right.
And and the mechanism for that is still being understood, but it's pretty clear that that connection is there. And then, of course, post-menopause, high blood sugar and metabolic dysfunction has a big role in not just health factors like, for example, weight, but also increased risk for chronic conditions like Alzheimer's.
Yeah.
Women, unfortunately, if you view it this way, are at much higher risk for many of these chronic conditions, for cardiovascular disease, for Alzheimer's and dementia. And so the impact of having metabolic dysfunction is even more pronounced in women than it is in men. So there's so many things that happen over the lifespan of a
Oh,
woman as she has all these different hormonal changes, and it's equally
bless
important
us.
the entire time. Right? Exactly. We are beautifully complex, and as you probably know, this has often been the rationale for why there's not very much research on women, is because we're so complex, especially women of reproductive age, that researchers feel that it's almost impossible to have the controlled environment that you need for, quote, rigorous research, that they've just decided to exclude women from the equation at all. And of course, I think this is a massive loss to our understanding
Right.
of science, but that's the reality of how things have been.
Yeah, it is. It's so true. So, for our listeners, they're thinking, okay, I really want to get a hold of my blood sugar, right? What are some strategies for blood sugar control? Like, so for foods, like what should we be eating in order? Like, give us a good layout for that for listeners so they can have some good takeaways.
Sure. I think the starting point is starting to just become much more aware of how your body feels as you eat different things. So if I were one of your listeners, I would go through my normal day of eating. And if I could have rewound the clock and done this when I was in my 20s, I would have
Right?
done this.
I
And I
know.
eat, right? Eat your breakfast and then really focus on, how do you feel? Do you feel like you're getting jittery? Do you feel like you're craving something all of a sudden? Do you feel like your energy is sustained, or is it crashing? What's going on in your body? And I think those signals, that's such important information that tells you probably what's going on. Of course, it's not as powerful as wearing CGM,
Oh, I
but it's the
know.
but it's the beginning.
Yeah.
From there, I think there's some basic pillars that you can use to improve your metabolic health. The first one is diet. So I think there's some kind of obvious things probably that people would think of being important to avoid, which is primarily processed food, high sugar foods, high carb foods. But there's also a lot of strategies to create meals that are purposely meant for glucose stability. So for example, pairing carbs that you're eating with fat and protein.
Yeah.
This creates a blanket around them, so to speak, so that when you eat them, the carbs or the sugar are not the first thing that hits your system.
Right.
The most common example of this is if you go to a restaurant and there's rolls or bread on the table,
I know.
you would be much better off, even if you've decided you're going to eat that bread, putting it to the end of the meal. First having your salad, first having your protein and your main course, assuming that your main course is not a bowl of pasta.
Right.
And then have the bread when there's something in your stomach to slow the absorption of the sugar. So food pairing is one. And then timing when you eat your meals with things like walks.
Love
So
that.
yeah, there's so much evidence that even a 15-minute walk, even shorter, if you do that after you eat, it will lower your blood sugar. And the reason is that your muscles are massive consumers of sugar because they need to function. And so when you walk, you're actively taking blood sugar out of the blood and you're putting it into energy for your muscles. So no matter what you've eaten, but especially if you've eaten something that you know is probably not good for your blood sugar, go out and take a walk. The final two things I would say on diet, and there's so much we could talk about for diet.
Oh, I know. Yeah.
One is fiber. So fiber really reduces the speed with which carbohydrates and sugar are processed into your blood. And it's also often linked to improvements in microbiome and all of these other aspects of digestion and health. So adding fiber, the statistic I think is something like over 95% of women and close to that percent for men don't get enough fiber.
Yeah.
And when we say don't get enough fiber, it's actually just what I believe is 30 grams, the conventional goal. And even that's not really enough.
Right.
So when you think, some people recommend 50 grams, almost nobody is getting 50 grams. So you really have to be thinking about on every meal, how can I add fiber to this? How can I make this more enriched? And then the final thing I would say is something that I think is really important when you're starting to experiment with diet is remembering that it's not just about, for example, keeping your blood sugar line flat. It's really about nutrient density. It's
Love
about, right? Like how can you power your body to have the signals to really just be most optimally functioning, to be most alive in your life, to feel the vibrancy of being alive. And I think that's just something so important to always keep in mind, because sometimes when people start doing blood sugar optimization, they'll do things like starting a keto diet,
Right.
which for some people works great, but you can have a keto diet where all you're eating is oil, butter, bacon, right? That maybe your blood sugar is flat. It probably would be on that diet, but that's not a nutrient dense, nourishing diet.
No.
So it's not really, I think sometimes people think about, they get the rules for their diet, so to speak, and then they exploit them. Like I saw a lot of people back when Atkins was much more popular doing that, where they would say, well, I'm on the Atkins diet, therefore I eat all the cheese and, pepperoni on the pizza. That's not really a holistic way of viewing nutrition. So that's my basic, and that's Level's basic dietary philosophy.
Yeah. And I know for me, like when I learned a lot that was the first time I just did this about a month ago. I did, your guys' monitor, and it was amazing and very eye-opening for me, because I found that when I just had protein and fat, let's say in the morning, if I was really quick with the breakfast, I was on the go, had to hurry. I wasn't as stable. I had especially if I was a little bit stressed, right? I didn't, my curve was not as flat, right? I had a huge spike. Whereas when I paired it with fiber and I took more time with that, with fat, I definitely had like a better energy throughout the day. I was more stable. So the fiber and the greens part for me was huge, because I would really quick just get some protein and some fat and hurry on my day, right? Especially to start your day off. And especially if you're a very busy person, have a stressful morning, have families, all the things, it really set the tone of my day differently when I didn't pair it with fiber. So it's so interesting with all the different fad diets, right? Carnivore, we got keto, we got all of them, right? So that's why I love CGMs, because it really shows you what's going on in your body, because no one is the same too. Don't you find that also? Like everybody is so different.
Absolutely. And I would say not only are people different from other people, but you might be different today than you are tomorrow.
Right.
So there's a lot that happens based on how well you slept, or what you pointed out, stress.
Yeah.
Stress is so powerful for blood sugar. There's so many people who have noticed when they're using levels that that, for example, their blood sugar spiked before they gave a presentation. They might not even have felt that they were stressed in that moment, but when you look at the evidence, clearly their body was getting ready to do something. Likewise, people have had arguments with their partners,
Right.
and they see their blood sugar really spike from that. Really, anything that triggers your body into either believing it needs to mobilize because you're performing or you're doing a presentation, or you're put into more of a fight or flight headspace where your body's like, okay, we might need to fight, we might need to flee. So we need some blood sugar available for our muscles so that we're ready to go. That impacts your blood sugar. And so I think, yeah, it's amazing how complex it is. And the more that you start to get in sync with things that trigger your blood sugar, the more you're able to control them. Like for me, sometimes I'll say, okay, I'm starting to feel my heart beating. Like I'm
Yep.
getting a little bit nervous for something that's about to happen. Okay, I'm just going to breathe, because I know that if I don't come back to that state, my blood sugar is really going to take off. And I don't really need that blood sugar right now. I'm not actually in a threat, right? Like nothing bad is happening to me. This is just normal life. And so I should bring my body back down to the physiologic state of normal life.
Right, exactly. Oh, stress. It is such a big one for so many people. And we all do our best to manage it, but you definitely have to put those tools in place because it's such a big driver, which just creates more hormonal dysregulation long term, right? So yeah, it's a big, big thing we all need to get a hold of. So how about the importance of exercise and good sleep with blood sugar? Let's talk a little bit about that.
Those are both so important. Exercise is one of my favorite tools because, for one, I enjoy it, but also it's such a powerful way to bring down your blood sugar. As we were mentioning before, the muscles use a lot of blood sugar, especially the big muscles. So when you exercise and you use them, you're really doing a benefit for your body of bringing that sugar right out of your blood and into your muscles. And there's different forms of exercise, and they're all helpful in their own way. So, for example, walking, like we said, even just a short walk, super powerful. Also, weightlifting, especially for women who might naturally have less lean muscle mass, but lean muscle increases the sink for glucose. So you want to be doing strength training if it's possible to fit into your life.
Right.
Right? Like I like to be kind of realistic about these things, because I think so often we talk about revolutionizing our lives, and it's like, realistically, a revolution for me this week is getting 7 hours of sleep 3 of the nights, right? Like,
Sister, amen.
right. Yeah. It's, this is the reality of life. So,
Yes.
I like to be flexible, but any amount of exercise really makes a difference, especially after you eat. So, maybe you don't even, maybe you can't go outside because you have kids in the living room. You can pace around them, or you can do some squats while you're interacting with them, or pick them up, put them down. Anything that engages your muscles is going to help. Sleep is so important. Poor sleep is linked to so many things. For example, inflammation, right? It triggers an inflammatory cascade. So now you're starting your day from a kind of a physiology in your body that is likely to not only create short-term damage, but if it continues, to ultimately create long-term damage. We know that interrupted sleep, disrupted sleep is linked to higher levels of insulin resistance, even in someone who doesn't normally have insulin resistance.
Yeah.
So, and at the same time, as I think we've all experienced, when you don't sleep well, you feel food cravings, right? Like, so you're craving sweets and carbs at the same time that your body is least able to deal with them in a healthy way. So you're in a very vulnerable situation at that point. Likewise, it can be linked with higher levels of cortisol, right?
Right.
The stress hormone. So
Yeah.
you add that to the equation. And of course, cortisol is linked to weight gain over time and a variety of other things. So you basically create this entire ecosystem of dysregulation. And, again, part of normal life for a lot of people, but to the extent that you can get less interrupted sleep, it will have so many beneficial impacts. in terms of how you feel and how resilient your body is to dealing with things that come up throughout the day.
Yeah. And also too, I see so much, and do you see a lot of insomnia with under eating and things too, especially like in postmenopausal women? It's just, you really have to be cognizant of that too, making sure you're eating enough and really replenishing your body and feeding it with fuel, like you said, with nutrient dense food. So I see so much insomnia, and there's such a big blood sugar component with that, don't you think?
Absolutely. And
Yeah.
the other piece of this is I think some of these trends like intermittent fasting, they encourage pushing those hunger signals away. And I know experts have different opinions on intermittent fasting, but
Yeah.
there's increasing suggestion that, for example, this is something that Sarah Gottfried again talks about, is for women, the optimal amount of time for fasting is likely very different than men. And actually, the traditional 16-8 intermittent fasting protocol was based on research on men. So
Right.
there's no reason to think that that would fit a female physiology. And it actually looks like for women, if you push off eating for too long, and specifically like if you fast for too long, or like you said, you're under eating, it actually can trigger cortisol and a stress response. And I think a lot of women can identify this feeling where you get to a point where you're so hungry, it's been so long since you've eaten, you don't even necessarily feel hungry, but what you do feel is like anxiety and almost panic. And I think if you're not cognizant of blood sugar, you don't necessarily link that to low blood sugar, but it's happening. And then you start to feel this thing of like, if I don't eat, or if something doesn't change, something bad is going to happen, right? Like there's
Right.
this, and then you respond to that eventually through eating, and likely eating more than you need to in that moment. And you begin this cascade again of now you have high blood sugar, and then it plummets, and then you're pushing yourself not to eat again. I think this is probably an entire other discussion,
I
but
know.
the issues around especially women and eating behavior and
Diet culture and
diet culture. That's
social and
right.
emotional. Yeah.
Yeah, it's so complex. And but from a blood sugar perspective, it has so much impact when you don't even necessarily hear your own hunger signaling anymore because of learned um really learning to ignore it because of all these things. I think there's a lot of healing that needs to happen there to get blood sugar under control.
Absolutely. Yeah. I know for me personally, when I had the CGM on, I wanted to play around with different things to see what worked for my body, especially with some light fasting in that follicular phase, right? Where my hormones are a little bit more stable. So I was playing with it, and I did not do well. I just did not. And it was a light fast, and I worked out fasting. Nope, that was a no-no for me too. So it's just so interesting when you really figure out what works for your body, and what works for one person does not work for the other. And that goes with any, type of health tip or anything, right? But for intermittent fasting, we find that too. It's definitely individual. You want to feel good when you do it, and you got to be careful and make sure it's right for you. So let's talk a little bit about lab tests and lipid panels and what they tell us.
This is such an interesting topic because I
Yeah.
think we're finally starting this transition from realizing that a lot of the testing that's happening in the conventional doctor's office is not actually giving us the full picture or the information that we need,
Yeah.
right? So, I mean, a really good example of this is the fasting glucose test or the hemoglobin A1C. These are the standard tests that a doctor uses to tell you if you have a blood sugar problem. But so there's a few problems. The first problem is that, as we discussed before, you can have insulin resistance going on for years and years before your blood sugar is fully out of control because your insulin is, to use the metaphor, is yelling at the cells and it's kind of working, right? You're pumping out a ton of insulin, but it's working and your blood sugar is still in the normal range. So that fasting glucose won't pick up a problem till the insulin is screaming and nothing is happening, and then things are just so dysregulated. But the other piece of this is that we're in this mindset often that if your lab is below a specific number, then everything is fine. And if it's 1 point above that number, then everything is not fine. And that just doesn't make sense.
Yeah.
Fasting glucose is on a spectrum. So having a fasting glucose of 99, yes, it's under the 100 cutoff for prediabetes, but it's very different than a fasting glucose of 85. So I think this is something that really needs to change in medical practices. When you see someone's fasting glucose rising over years, even if it's below the threshold for prediabetes, that does not mean everything is fine.
Right.
So that's just one example of a test. I think on the lipid panel, there's some markers that are given probably more weight than they should, connected to the amount of information they actually give, and then others that are less. So an example is, for example, a lot of people are fixated on total cholesterol.
Right.
Total cholesterol is certainly one piece of input, but it's really not the full picture in any way. So to really focus on that as the primary metric, it doesn't make sense. Versus you look at, for example, triglycerides or the triglyceride to HDL ratio, which are very close links to metrics for insulin resistance. Those will give you a lot more information. And I think the overall theme is that it's a puzzle. And
Yeah.
you need to have as many windows into seeing what's going on as possible, right? For some people, that's wearing a continuous glucose monitor. For
Right.
other people, that's looking at their triglycerides in relation to their HDL, maybe in relation to a fasting insulin, and putting all of those together. So there's no one way to do it, but I think it's really important that people move out of the mindset of either they're okay or not okay, and also move out of the mindset of trying to optimize for one metric.
That's awesome. I love how you explain that. It's really important to look at it that way. So let's talk about levels. Let's all, in your involvement with it. Let's talk about how patients, could possibly get it, what's involved. Let's talk about it.
Great. I love talking about levels. I feel so grateful to work for a company that's working on a problem that I care so much about. And like I said, this was a product I wanted for myself.
Right.
So Levels is available to everyone now. You can access it through our website at levels.com. And I'm sure we can put a link in the podcast
Absolutely.
notes here as well. It is basically, so Levels follows a membership model, which means that you become a member of Levels, and then you have the opportunity to purchase any of the service and products that we offer. So, for example, the most common one, of course, is the CGM. And of course, there's also the software piece. So basically, when you join Levels, you download the app, and the app is really what guides you through the experience of making sense of your
It's
blood sugar data.
awesome. The app is awesome. Like it
I'm
just
glad you feel that way.
everything. Really and truly, it's really good. It really made me like motivated to check things and look at my overall metabolic score, all the things. It was awesome.
That's great. Thank you for that feedback, because we really are working so hard to continue iterating on that, changing it, listening to how people are interacting with it, and just really trying to make it as powerful as possible to both help people understand their health, but also to motivate them and guide them and support them in behavior changes. So that's really the centerpiece of Levels. And then if you are using the CGM, of course, you're getting the glucose data. We also offer at-home metabolic testing. So the lab tests that you don't get in your doctor's office, often we have someone that can come to your house and do those lab tests for you. And that information will then be integrated into your Levels app experience. We have access to one-on-one consultations with nutritionists who are experts in metabolic health. So it's really meant to allow people to guide their own experience and to decide what's most impactful for them. Like maybe you're someone who wants to wear CGM all the time. That's
Yeah.
great.
Yeah.
Maybe you're someone who wants to start with lab testing and
Yeah.
then make some changes and then put on the continuous glucose monitor once you have kind of gotten a feel of where you might be. And of course, different people have different times in their lives, right? Like if it's a time where you're traveling a lot, or you're really busy with things, or you're stressed, or maybe you don't have the financial resources at this moment to invest in certain aspects of Levels, that you can still access all of our free content, or you
Yeah.
can still use the app, right? Which has a ton of guidance. And we try to take insights from this massive data set we have and provide them to everybody, both through our blog, but also through the app content. So even if you're not wearing a CGM, you can benefit from those insights, and you can say, oh, well, for the majority of people, oatmeal creates a spike. So maybe I'm going to switch out my oatmeal. I don't even necessarily
Yeah.
need to see my glucose. I know that that might be healthy for me. So it's really meant to be as flexible as possible.
Very cool. So where else can people find you?
So Levels has a great blog, levels.com, and you can access the blog there. We also have our social handle, which is at Levels. And then I also have my own channel at Dr. Kelley-Chew, where I'll be sharing all kinds of really simple metabolic health tips that you can do even if you don't have access to, for example, fancy grocery stores or tons of time or whatever it might be, but just little things that we can all do that have a big impact on our health.
Well, thank you so much for coming on today. We really, really appreciate it. You're just so knowledgeable. You explain things so good. You really break it down good for people, and they're going to get a lot of tools to take home with them. And hopefully they try out the CGMs. It was life-changing for me, that's for sure. So I'm definitely a fan. So thank you so much for coming on.
Thank you so much for having me. This was really fun.
Absolutely. All right, everybody. Thanks for listening.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on drbeckycampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Crystal Hohn. Have an amazing day.